My name is Catherine Koch, and I'm doing my project on the Centers for Disease Control and Healthcare and how they relate. What is the CDC? The CDC stands for the Centers for Disease Control and Prevention. The CDC is one of the major operating components of the Department of Health and Human Services. Their mission is to say they are 24/7 saving lives and protecting the people. The CDC has a mission. The mission is to help the general public and even health administratives and everybody in a hospital. CDC works 24/7 to protect America from health, safety, and security threats, both foreign and in the U.S. Whether disease started at home or abroad, or chronic or acute, curable or preventable, human error or deliberate attack, CDC fights disease and supports communities and citizens to do the same. CDC increases the health security of our nation as the nation's health protection agency. CDC saves lives and protects people from the health threats. To accomplish our mission, CDC conducts critical science and provides health information that protects our nation against expensive and dangerous health threats and responds when they arise. The CDC has a couple roles: detecting and responding to new and emerging health threats, tackling the biggest health problems causing death and disability for Americans, putting science and advanced technology into action to prevent disease, promoting healthy and safe behaviors, communities, and environments, developing leaders and training the public health workforce, including disease detectives, taking the health pulse of our nation. The CDC is definitely current in the 21st century. It's current on the cutting edge of health security, confronting global disease threats through advanced computing and lab analysis of huge amounts of data to quickly find solutions, putting science into action, tracking disease and finding out what is making people sick and the most effective ways to prevent it, helping medical care, bringing new knowledge to individual health care and community health to save more lives and reduce waste, fighting diseases before they reach our borders, detecting and confronting new germs and diseases around the globe to increase our national security, nurturing public health, building on our significant contribution to have strong, well-resourced public health leaders and capabilities at national, state, and local levels to protect Americans from health threats. And the CDC also has a pledge to the American people, is to be a diligent steward of the funds entrusted to our agency, provide an environment for intellectual and personal growth and integrity, base all public health decisions on the highest quality scientific data that is derived openly and objectively, place the benefits to society above the benefits to our institution, threats all persons with dignity, honesty, and respect. The CDC has several different ways to respond to the emergency response. They work with hospitals, disasters, and even just the general public to help respond to emergencies better. They are the Division of Environmental Hazards and Health Effects Health Studies branch at the Center for Disease Control and Prevention has developed the Community Assessment for Public Health Emergency Response, also known as CASPER. CASPER Toolkit to assist personnel from any local, regional, state, or federal public health departments in conducting the CASPER during disasters. One of the main objectives in developing this toolkit is to standardize assessment procedures focusing on the United States disaster response. The CASPER Toolkit provides guidelines on data collection, tool development, methodology, sample selection, training, data collection, analysis, and report writing. The CDC has developed an environment health shelter assessment tool to assist environmental health practitioners in conducting a rapid assessment of shelter conditions during emergencies and disasters. This tool is an assessment that covers 14 general areas of environmental health, ranging from basic food safety and water, quality to pet, wellness, and allows for the documentation of immediate needs in shelters. It can be easily modified to meet local needs. They also have a bunch of other emergency response, but these are just a few of them. has come up with a way to communicate better during emergencies. This helps with public health administrators when everything is just going to a disaster. It can be a tornado, it can be hurricanes, it can even be an epidemic. So the CERC, which is known as Crisis Emergency Risk Communication, is an approach to communicating effectively during emergencies. These principles are used by public health professionals and public information officers to provide information that helps individuals, stakeholders, and entire communities make the best possible decision for themselves and their loved ones. CERC recognizes that during emergencies we work under impossible time constraints and must accept the imperfect nature of our choices. CERC draws from lessons learned during public health emergencies and research in the fields of public health and emergency risk communications. With the CERC, they can assess what they did in the emergency and draw back what they need to do better in the emergency next time to prepare. This is always ongoing and a way for hospitals and health administrators to work better when a disaster hits. CDC is always preparing for any certain attacks to come. They take what they're prepared for and they send it out to hospitals and hospital administratives to get them to be able to prepare for a certain attack. Just like the Ebola scare, there is a scare for anthrax, a bioterrorism, victims, and staff members. The one I will talk about right now is just going to be anthrax. They are prepared for any attack to come and they will take it as it comes. The CDC is working with other federal agencies and health departments across the country to prepare for an anthrax attack. Activities include providing funds and guidance to help health departments strengthen their abilities to respond to all types of public health incidents and build more resilient communities. Providing training and emergency response for the public health workforce and healthcare providers, as well as leaders in the public and private sector. Coordinating response activities and providing resources to health departments through the CDC Emergency Operations Center. Regulating the possession, use, and transfer of biological agents and toxins that could pose a severe threat to public health and safety through the CDC Select Agent Program. Promoting science and practices to strengthen preparedness and response activities, ensuring that the United States has enough laboratories that can quickly conduct tests with anthrax is suspected. Working with hospitals, laboratories, emergency response teams, and healthcare providers to make sure that they have the medicine and supplies they would need if an anthrax attack occurred, and in developing guidance to protect the health and safety of workers who would be responding during an anthrax emergency. So every time there is any scare, they come up with a different way to respond. Just like the Ebola, they had to come up in a quick hurry how hospitals would treat their staffs. And if you walk into a hospital right now, they have a big sign saying, if you've been out of the country and you have these symptoms, stop here and get somebody to help you right away. So it's always keeps going on. They are always preparing and they always share their plans with any hospital, public, or health administrators that are interested. Lastly, where is the CDC? The CDC is in 60 plus countries. They are all over the world. They are always trying to get more people out there. They currently staff 1,700 people located all over the world. If you go in and look at their jobs, they even have jobs for Afghanistan right now. They are trying to get more people out there in places that we need help with, especially with now that we had the Ebola scare. They're always trying to improve. They're always providing information to the public and healthcare workers. The CDC leverages its core strengths to advance 4 overarching global health goals. 1 is improving the health and well-being of people around the world. 2, improving capability for preparing for and responding to infectious diseases and emerging health threats. 3, building the country public health capacity. And 4, maximizing organizational capacity. You can also look at more of their global health strategies on the CDC's website. Our global programs are run by world leaders in epidemiology, surveillance, informatics, laboratory systems, and other essential disciplines. Through partnerships with other countries' ministries of health, CDC is improving the quantity and quality of critical public health services. Currently, the global programs address are over 400 diseases, health threats, and conditions that are major causes of death, disease, and disability. These programs provide a strong foundation for protecting Americans from major health threats wherever they arise. That's the end of my PowerPoint. I thoroughly enjoyed looking up everything about the CDC. It's always been a dream of mine to eventually work for them once I graduate. I even enjoyed looking at the jobs that they had displayed. That's the end, and I hope that you learned something. These are the sources that I used. I used a few outside sources and a lot of peer-reviewed sources. Thank you.